When you hear the words breast cancer patient or survivor, what images come to mind? The faces you're seeing now are all people that have heard the words, "You have breast cancer." And yes, men are included. Most people know that 1 in 8 women are diagnosed with breast cancer. But did you know that 1 in 726 men will also be diagnosed in their lifetime? They often have a poorer prognosis due to being diagnosed at a later stage, simply because they didn't realize they could be diagnosed. In 2012, Carrie Madrid had just turned 41 years old and was diagnosed with stage 3 breast cancer. They actually found 2 tumors, which ended up being 2 different types of cancer: infiltrating ductal carcinoma and ductal carcinoma in situ. Her very first mammogram confirmed her diagnosis. At the time, Carrie's young adult son was serving overseas in the United States Air Force, and her 2 daughters were only 12 and 15. She was fortunate enough to work from home, but lived check to check, and cancer certainly wasn't in her budget. Thankfully, Carrie had family that stepped up and helped her get through financially, but it wasn't without the use of multiple credit cards. Meanwhile, in treatment, Carrie met a number of patients who had to make the difficult choice between food for their kids or a copay for chemotherapy. So, Carrie talked to her best friend Christina about it and discussed how no one should have to make that decision. And they made a choice to do something about it. The CareProjectInc.org was born in 2013 and became an official public charity in 2014. So what does the Care Project Inc. provide exactly? Well, they provide financial support, which includes copays for treatment or surgeries, helping out with your rent or utilities, or even helping with groceries or transportation to said treatments or surgeries. They also provide emotional support, peer-to-peer survivor mentors, and their Survivor Social Club. Lymphedema Care. Through a long-standing partnership with Lymphedivas, the Care Project is able to provide breast cancer survivors with complimentary sleeves, gauntlets, and gloves to help manage the painful side effects of lymphedema, a condition that many develop following a mastectomy and lymph node dissection. This is a lifelong side effect, and sometimes insurance companies do not cover this expense. They also offer end-of-life doula services. Carrie became a certified care doula, also referred to as a death doula. She walks beside a terminally ill patient as they prepare to die. This includes facilitating family meetings, serving as an advocate for the patient, providing education on the dying process, and respite for the family and caregivers, as well as ensuring the patient's environment is exactly as they wish. Our Men Too program was established in January 2024 and is our nationwide program. It's just for males affected by breast cancer. Pat Washburn serves as the director of this program. She lost her husband, Marlon, to metastatic breast cancer within months of diagnosis. She is truly a global advocate, lending her ear and love to men and their families who are enduring breast cancer treatment. She drives across the country in her Marlin Mobile, speaking to anyone and everyone who will listen. Our latest initiative is very special in that it provides grants to children left behind when a parent dies from breast cancer. Adam's Angels. Adam is a 5-year-old who lost his mom, Carmen, to metastatic breast cancer after she had just turned 30 years old. Carmen was an incredible mommy, friend, life partner, sister, daughter, and niece. She was the baby of our social club and very special to all of us at the Care Project. Our motto is never stop caring, and we hope that you'll join us in our mission.